that up. Super useful for those at home.
Hey, Steve, we can't hear you.
It's my whole intro, so I guess it's a good thing recorded and hopefully it recorded sound. But anyway, so the idea of the rows, just to back up so everyone at home doesn't miss it, is the ideal of potential. And that the entire system of your body, everything is controlled by your nervous system. That if that is not working properly, then nothing else can work properly. And that is really the takeaway I want you to have. And I realize some of you already have that, but the potential of your health is nothing compared to what it could be if your nervous system isn't working at its absolute primary. So that means you could be that elite athlete that we talked about a moment ago that's at the very top of their game, that has that 5% body fat, can run a mile in 3.5 minutes or whatever it is. And if their brain and body isn't communicating the way it's supposed to, if they're living with subluxations and a shutdown of at least 60%, if not more, just because they feel okay, they're not as elite as they could be. They're not living at their highest possible potential. So if my clicker will work, we can just stay on the rows all day. It's pretty. There we go. So the founder of chiropractic, and we'll go into that story just really quickly, but one of his quotes, and my favorite ones, is there's a vast difference between treating effects and adjusting the cause. So how many doctors do you go to, or what other healthcare professions outside of primarily chiropractic are we really seeking to fix the cause as opposed to treating the effect? This is not a new conversation. The very first chiropractic adjustment was done in 1895 on the, it was the maintenance manager of the building who had fallen off a ladder 17 years before, lost hearing, and his atlas, that very top bone, was out of place, got adjusted. There's a lot more to the story, but we won't have time for the whole thing. Got adjusted, and later that day, he could hear the horses and carriages on the cobblestone streets outside. Wow. So chiropractic was not founded on the idea of back pain, neck pain, headache, sciatica. It's great at that stuff, but it's really founded on the idea of potential and what your body could do. And as the story goes, of course, Dr. Palmer turned around and said, well, I have the cure for deafness. Well, that didn't work for everybody that was deaf. And then a couple people that couldn't see all of a sudden could see. So I have the cure for blindness. As they figured it out, going through the process, they had the realization that it's not the cure for any specific thing. It is allowing your body to work at its absolute best. And okay, cool. And my technology clearly doesn't. So an example of potential is, this is someone who came in, this is just 6 months into care. And if you've looked at x-rays recently, you know, we can tell that this is not a healthy spine. And the reason I picked this one is you can tell it's the same person by the dental work, right? So I could easily just put up somebody else's neck, but I did it on purpose with the dental work. You can track it. But this person started off with zero curve of their neck, evident arthritis and breakdown in their neck, what would be considered phase 2 breakdown, where the back part of those discs, they're almost non-existent in a few of those spots. And 6 months later, their curve is not perfect, but it is coming back, and you can clearly see every single one of those disc spaces. So it is a common belief in our healthcare system that once you have degeneration and arthritis, you have it for life. It's also a common belief that part of life is getting degeneration and arthritis. It's not an uncommon conversation that you go with one of the symptoms that we mentioned, and your doctor says something like, you're just getting older, it's part of life. Because one of the challenges we have in our healthcare system is we've forgotten the difference between common and normal. If something happens to enough people, it's now considered for many of our healthcare professionals a normal thing because most of their patients have it. During the pandemic, there's now 42% of the American population is considered obese. That's terrible. Where's the conversation that we know that one of the #1 reasons why people are going to struggle the most with coronavirus is they're overweight? That's not a conversation that's happening in most circles. But for the first time in history, it's 42%. And it's so much so that it's almost looked at as, well, that's just America because it's so common that it's normal, but it's definitely not. So if you may be sitting at home or one of those people who are struggling with that, I do not pretend to be a dietitian, and I have a lot of skill sets and a lot of education and nutrition to maybe help guide you on the right path to get out of that situation. Because whether it's corona, whether it's your pain, whatever it is, if we're carrying around a lot of extra weight, and I think it's either next week or 2 weeks, we're actually doing a workshop specifically on nutrition. What that actually does is white fat is the fat we put on as we get older. And white fat actually releases inflammation in your body. So it is a really easy to see that once we understand that if you're walking around with extra pounds that you shouldn't have, why you might feel terrible and not want to get up and move. Because all of those cells are now releasing more inflammation, and inflammation equals pain. And I'm off topic, so we're going to get back on. And this just isn't going to work tonight. That's cool. You know why it's not going to work? Because it's plugged in over here. Subluxation. So being connected is really important. All right, let's try that again. So Hippocrates, considered the father of modern medicine, although I think he would challenge that at the moment. But anyway, he is actually, one of his most famous quotes is, look well to the spine for the cause of disease. So in our healthcare, we have a lot of amazing, very intelligent people who specialize in specific systems of the body, and they save lives every single day, and thank God that they exist. But the cardiologist doesn't necessarily think I should look back to the area of the spine where those nerves actually come from that tell the heart how to beat, what electrical impulses to use, how much force to use. They just look at the heart and say, well, there's something wrong with it, so we need to do something for the heart. The liver specialist, the kidney specialist, all the same thing. They are so amazingly skilled and specialized in their zone of the body. Sometimes I believe they forget it's supposed to be an entire body that works together. So then sometimes maybe they do things like, let's remove a piece of that and see what happens. The rest of the body suffers. So if we really want to be our absolute healthiest, then we have to think back to that rose and its potential. There is no one on the planet that would not benefit from getting their spine and nervous system checked. It does not have to be in this office. Heck, I don't even know if I like everybody or they're going to like me. But what's important is if we really want to live to our greatest potential, then we need to be living in a system that's properly connected. So a couple of years ago, I think maybe more than that, there was an exhibit going around called Bodies. Anybody go see it? It was like all the different parts of the human body. And one of the things that maybe it was more than a few years ago, maybe I'm dating myself a little bit, but it was when I was in clinic in Long Island. It came in New York City, so we went and saw it. And basically it was the different areas and systems of the body. One of the things that they did is they removed every tissue except for the nervous system. And it's been estimated that most of us could actually still recognize each other if the only thing left was the nervous system. Wow. There are so many nerve fibers. If we kept all of them, we could still recognize each other if there was nothing else. So the idea that sometimes we focus more on other areas and we don't necessarily look to see if the nervous system is working right or the brain is functioning right, just simply means we're missing the boat of what's possible. So, you know, an example of this are just the bigger nerves, but there, I mean, you get a little cut, you feel it. That means there's a nerve there, whatever it happens to be. So the Windsor autopsies, and I removed the text on purpose, but anybody ever heard of Dr. Windsor? Back in the early 1900s. So he was a medical doctor who said, what are these crazy chiropractors talking about? How can moving and popping a bone in the spine actually do something for someone's vision or hearing or digestive issue or whatever it is? So what Dr. Windsor said is, he said, well, what chiropractors are claiming is if there's abnormal curvatures, abnormal positions, if there's degeneration and arthritis, that negatively affects health. So if they knew someone died of something, like they knew they died of a heart attack without a doubt, they knew they died of kidney failure, liver disease, whatever it is, I think it was 1,200 or 1,500 autopsies that he did. And what he did is he said, okay, we know this was the cause of death. So let's track that nerve all the way back to the spine and see what we find.
Congratulations.
What do you think they found? And Facebook, see you later. Come join us on Zoom. 98% of the time, they found abnormal curvature, they found degeneration arthritis, they found pressure on that nerve that shouldn't have been there. So, okay, we could say that was done in the early 1900s, so maybe we should have some better science in that. So in 2012 and 2015, respectively, there were another couple MDs who did the same thing. And they actually found, and I can't remember the name of the one off the top of my head, we have the research available, 100% of the time. So my question is, why is this not the conversation we're having when people are challenged with whatever it is? If you're in terrible pain, then painkillers could be the solution for right now, temporarily. It should not be the solution forever. A couple weeks ago, I think it was 2 months ago, we did our prescribed epidemic class focused on opioids, how the opioid epidemic happened and all that. And it happened primarily because 30% of the US population lives in chronic pain. And most of them have never even thought of the conversation of, should we be checking the brain, that is the source of all information, and actually how that pain is responded to, as we're going to see in the research up on the next slide. They're just given the medication to try to drug the problem away, or to put differently, they're working on the effect as opposed to adjusting the cause of the problem. And then the Nobel Prize winner, Dr. Roger Sperry, states that 90% of stimulation and nutrition to your brain comes from the motion of your spine. So what's a very significant issue that's affecting a lot of our, we'll just say generally older population right now? Alzheimer's. It's estimated on a financial burden, let alone the emotional burden, that most Alzheimer's patients are going to need somewhere around $1 million worth of care every year just to help them. So if we knew that there was something that 90% of the stimulation and nutrition of the brain comes from it, maybe it would be a really good idea to make sure that it's actually moving the way it's supposed to, right? Again, not the common conversation. Why we do these workshops is not just so you have the information, so that you bring it to other people. Because if more people understood how the body works, it would not be a question of how often do I get adjusted, or should I get adjusted, or should I see a chiropractor for my problem or not. The only question would be, how do I do this for the entirety of my life and make it something that's sustainable? Because if we know just these two pieces, and then we're going to look at two more pieces of research before we wrap up for the evening, and our goal is being healthy and living a really long time, then we have to focus on the primary system. It doesn't mean you have to be here multiple times a week, or even weekly. As we know, the research suggests that weekly care is wellness care, because with weekly adjustments, you can remove any damage that happens within the week, and bi-weekly adjustments, you can have irreversible cartilage and ligament damage. And I realize I'm throwing a lot of little pieces in, but that's kind of the purpose of this workshop. So whatever you want in your health, I would guarantee pretty much that anyone who's not where they want to be would do something different if they knew they could do something different. And it is such a common conversation that when someone walks in that exam room and I meet them for the first time, that they are here because they tried everything else, nothing else worked, or the things that they're doing are not giving them the result they want. And nobody really told them to try chiropractic. Or if they did, it was, well, maybe try, but maybe it won't work. So on our next piece, so neuroplasticity. Anybody heard of this one? So there was this theory for much of human existence that the brain you're born with, I said that right, is all the cells you get in your brain. And all the neurons that you get are there at birth, and then they slowly decline throughout life. Just purely the fact that the size of your head changes should question that. But anyway, that has been the long prevailing theory until the science of neuroplasticity and neuroelasticity basically in the 2000s and so has come out. And what they actually found is we know that spinal function affects brain function, that there is now solid evidence that adjusting the spine changes the function of your brain. So what they now know is if things are properly connected, you can actually grow new connections in your brain. It's why, we hear stories about people who have significant brain traumas and are still able to function relatively normally. That only happens because your body is a miracle and it's amazing, and it doesn't happen for everybody, but it has the possibility or the potential to do way more than any science could believe is possible. The other part of that is specifically, I love to share this from during adjustments at least once a day, is the prefrontal cortex that lives basically right here, is responsible for your behavior, your goal-directed task, your decision-making, your memory, your attention, your intelligence, your processing of pain, so those 30% of people in chronic pain, your emotional response to that pain, your autonomic function, which is all the things we don't think about. It's your heart beating, your lungs working, your food digesting, motor control, so your ability to move your body, eye movements, and spatial awareness. So would it be a good idea to find out if those things are working properly? That's just the prefrontal cortex, let alone everything else in your entire body that's being controlled all the time. So what they actually found is when people get adjusted, they have a minimum of a 20% instant increase in the function of their prefrontal cortex. So I often tell a lot of the students we take care of, hey, if you're going to go take a test, come and get adjusted first. They kind of laugh it off. I'm like, no, seriously, it literally boosts your problem solving ability. So if you've been studying your butt off and you're challenged with a subject and you get adjusted to allow your brain and body to work better, you have a 20% higher chance of getting a better grade on that test. That'd be pretty big. Now, what if it's your everyday life, right? So any one of these things that's on that list, we can make an entire conversation that lasts way more than 30 minutes about, and all the research, all the science, all the neurology, all backs up that the very simple thing of adjusting the subluxation and removing that pressure off the nerve has profound effects that even science now doesn't completely understand. And neuroplasticity is relatively new. The first study that study we looked at is 2016, and they've been doing some more since then. But the things that chiropractors have said since the beginning, now science is catching up to, which often happens in any version of healthcare. Doctors notice patterns, so we believe they have relations, and then some 15, 20, 40, or 50 years later, the science finally catches up to it. Which is why Science is never settled. I don't want to get into a conversation. That's a heated debate at the moment. But the science is never actually settled. If you understand how research works and the design of science and the scientific theory, there is no possible way for science to ever be settled, or it's not actually science. So moving past that is clarity is the first rule of success. So you were the most recent new patient. So do you remember the question Nellie asked you at the end of your first day? You do not. Do you remember the question? I'm going to write down the list, or I'll just tell you guys if you don't remember. So the question was something very similar to, we just went through your whole history, basically dug back from what happened to you from the moment you were born until now, and any impacts or traumas you may have had to your spine, because they're all important. The question was something along the lines of, if we find we can help you, and if you choose to have us help you, what would you like to see that's different about your health, not just feeling better? So not just beside your pain. And if you say, I just want to feel better, I totally get it. And Nellie is amazing, and she digs beyond that. Because if all you're here for is pain, what happens when your pain goes away? You're gone with your pain.
Right.
And we've totally missed out on all the possibilities of your neurology really changing and functioning even better for your entire life. Is that better? Is drugless pain relief better than drug pain relief? Absolutely.
Yeah.
It doesn't have any of the negative side effects of a lot of the drugs out there.
Yeah.
And it's only a little bit better if we're not really focused on how do we help our bodies work their absolute best for the entirety of our lives. That's why lifetime care, as we often talk about it, lifetime care is not an option. The fact is we're all going to be here and we're all going to care for our life for the entire time that we have.
Right.
The question is, what is the value or the intention that you're going to put into that lifetime care? So I've sprinkled a lot of different information in tonight, like things like wellness care is getting checked at least once a week. Neuroplasticity can happen, or it does happen. Another one is they've done research that found that there are lasting neurologic changes somewhere around the 150 adjustment mark. So that doesn't mean at 150 adjustments, everything's fine and you get to go. It means we've actually accomplished some lasting neuroplastic changes in your brain and increases in your base level function somewhere around 150 adjustments. So for those of you who have, or any of you probably know this, how many adjustments were in your first year of care if you were a full 12 months, roughly? Yeah. So it's that's not by chance, right? So it's somewhere between, if it's a 6-month plan, it's somewhere around 50 or 60. If it's a 1-year plan, it's somewhere between 120, maybe 150, something like that. It is not by chance that we've designed our care plans that way. And yes, there could be variations along the way. It's why we do re-exams every 8 or 10 visits to find out exactly what you need. And most people by the end of the first year, they might not hit that 150 mark, but we're going to be getting semi close to it because we know neurologically what can happen. If you can get set that far within your first year and potentially undo years of damage, then there's a really high likelihood that I'm going to help you make a wise decision of maybe continuing to work on your nervous system and your brain health. Not everybody's going to do that. Some people are going to show up when they're in pain and they're going to be gone in 5 or 6 visits when the pain is gone, or if that takes 20 or 30 or 50 visits to some of the research states for something like a migraine or a sciatica, it could take some more to get there. And if all you're doing is showing up here for your symptom, we're missing out on the potential of what's happening.
Right.
You're basically staying that unopened rose, which is still beautiful to look at and is great, and it's not exactly what could happen. So our goal is to help you accomplish the things you set out to do in the first place. And if you set out to get out of pain, remember, Nellie dug further into that question, because there is so much more in life than simply being out of pain. And I say the word simply not to offend anyone, because I realize that could be offensive, especially for someone who's in that chronic pain, who's been dealing with this for decades potentially, because even having less of that pain could be a huge victory. And we're still missing the boat if all we're doing is working on our symptoms, if all we're doing is seeking that 8% body fat, that be able to run the mile, the whatever the function is, be able to bench press 3 people, I don't know. We're missing the boat if your brain and nervous system are 3 big people, who knows? If your brain and nervous system are not working the way they're designed to. So my final, almost final question for you is another BJ Palmer quote. So D.D. Palmer was the founder of chiropractic. Am I saying? Yeah. And BJ was his son. So he was like, one is considered the founder, one is considered the developer if you read historically. So one of his quotes that's my favorite is, have you more faith in a knife or a spoonful of medicine than the power that animates the living world? And if you do, then maybe chiropractic is not the answer for your solution. for your problem, the solution for your problem. And I think we'd be really hard pressed when in another seminar that I was in, it's something like 88 or 92% of the US population have some version of a belief system that there's a power greater than themselves. Not everybody does, but most do. So if they really believe that and you ask them this question, they're going to answer, I have more faith or more belief in the power that helps every single cell in my body work almost perfectly every single day than I do in that pill that's supposed to help me feel a little better. So where I want to end our conversation is you have a responsibility to share this with other people. Maybe they're local, maybe they're not. I guarantee you all know people who are not living at their greatest possible potential. And maybe they just simply don't know that simply getting checked to find out that could be a miracle in itself. So it's not only that, but while we're in the midst of Corona, I am still very much committed to getting out and sharing this information in the community with the zero goal of having a single person show up here, but the primary goal of getting truth out. Because if more people can take responsibility for their own actions related to their health and otherwise, and learn that there are greater opportunities than what many of us have been taught to believe or what our healthcare system has told us, then we can raise the intellectual wisdom of our community. Then we can make better choices, discern the difference between what is really good for us and what just simply looks good, is shiny and smells nice and whatever, and is ultimately going to continue our demise. Because people deserve more than what we have right now. The United States right now is considered a health disadvantaged country. That's ridiculous. We spend 2.4 times more than any other country on the planet, and we have some of the worst healthcare on the planet. Not because there's a problem with the doctors, there's a problem with the system. The doctors are amazing. They're there to help people. They have life-saving things. I guarantee there was a bunch of lives saved up the street at any of the hospitals that are within a couple miles of here. And we can't expect to achieve our greatest potential by using something designed for tragedy intervention. So my ask of you, and if you're at home, I'm going to put the survey up, and the end of that survey is not just who do you know that could benefit, whether it's here or someplace else, but where do we need to go? Because you all know communities of people. If they're comfortable with me getting in a small group like we are now, I'm great with that. If it's doing it over Zoom or something of that sort, I'm great with that. Because people don't know what people don't know. So I don't remember, it's either this next week or the week after that pain-free foods one, but that alone, easily 42% of the people in our entire region, which Portsmouth is actually higher than that if you look at the health stats. Entertain me, I have an extra few minutes. So one of the reasons I'm here is this is one of the unhealthiest cities in the entirety of Virginia, and we actually hold the #1 spot in things like prostate cancer deaths, because nobody's having the conversation about being proactive. So we're here because this is a community that needs it more than anything else, and I can't do it alone. So I'm simply asking for help. So have a wonderful evening. The survey is up, so remember you got to fill the survey out to get credit to be online. I'm going to cut the video and audio off, and then the rest of the class in a couple of minutes. Cut it off. All right, everybody at home. So I am going to end it. So hopefully you've clicked on that survey. Have a good night.